morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. Friends, as we know, we are discussing about the convulsions, seizure and epilepsy. In the last class we have seen up to this point, that is different types of epilepsy we have seen, like idiopathic epilepsy, just nomenclature we have seen. Grand mal epilepsy, generalized tonic-clonic epilepsy, petit mal epilepsy, Rolandic epilepsy, partial epilepsy, temporal lobe epilepsy. We will see all these epilepsies in detail later. Now we come to the next point. Why this epilepsy occur? We told that repeated seizures or recurrent seizures or spontaneous seizures when occur repeatedly, then it is called as epilepsy with the motor, sensory and psychomotor or autonomic changes. Now the question is, why exactly the seizures or epilepsy develops? Now, as we know, the basic pathology basic pathology for the seizure or epilepsy is abnormal electrical discharge. Okay, the electrical discharge which is produced inside the neuron is abnormal. Either it is more or either it is less. Okay, so two type of neurotransmitters are present in our brain basically. One set of neurotransmitters are there which are called as excitatory neurotransmitters. Another set of neurotransmitters are there which is called as inhibitory set of neurotransmitters. Whenever we want to initiate a function, okay, stimulate a function, it may be carrying the stimulus or giving a response to the stimulus. Whenever we want to produce any particular action for the activity, always it is exciting type of neurotransmitters which will work. When we have to finish a given function, then it is always the inhibitory neurotransmitters which will going to work. Okay, suppose if I want to move my limb, then the excitatory neurotransmitters which is present in the motor cortex area, they will stimulate and they will perform the work of movement of my limb or contraction of my limb. When I want to go for relaxation of the limb, then the inhibitory type of neurotransmitters will work and they are responsible for relaxation of this muscles and inhibition of or ending of this particular process. Okay, so when excitation of the particular neuron takes place, there is inhibition of the surrounding neurons. So action will be very specific. That means what happens is whenever I start contracting my muscle, some set of neurons which are present in the motor cortex area, so they will now start excitation, isn't it? In the meantime, when they start excitation, surrounding that particular excitatory neuron area, there will be some other neurons which are called as inhibitory neurons. So they also start stimulation and they always looking to the fact that this particular contraction or movement should not be overshooted. Okay, so I want to do a action like this, suppose movement of the hand. Okay, so this will be done by the excitatory neurotransmitters. But meantime, there is also stimulation of the inhibitory neurotransmitter present surrounding them, so that my action should not be overshooted like this. My action should be very specific, to the point. So that means for each and every action, there will be stimulation of the excitatory and as well as inhibitory neurotransmitters. When you want to finish the function, it is the inhibitory neurotransmitter which takes the upper hand. When you initiate the function, it is excitatory neurotransmitters which take the upper hand. Okay, so there may be overfunction of the excitatory. Sometimes what happens, there may be overfunctioning of the excitatory neurons and sometimes there will be overfunctioning of the inhibitory neurotransmitters. Okay, so now we have got excitatory and as well as inhibitory action, and actually both should be in a balanced way so that action will be very specific or motor activity will be very specific. But sometimes excitatory will going to stimulate more and sometimes inhibitory will going to stimulate more in case of abnormal electrical discharge. Now come to the next point. The excitatory neurotransmitters which are present in the brain, okay, so they are containing some specific neurotransmitters. So this differentiation between excitatory neurotransmitter and inhibitory neurotransmitter is made on the basis of neurotransmitter which is present inside it. Now those neurons which contains glutamate, adrenaline, noradrenaline and as well as dopamine as their neurotransmitters, they are basically excitatory in nature. And those neurons which contains neurotransmitter as GABA, gamma aminobutyric acid, serotonin, etc. are basically inhibitory in nature. This is the most basic information. Okay, so there may be when I say there is over-functioning of the excitatory neurons, means there is overproduction or over-release of the neurotransmitters like glutamate, dopamine, or adrenaline, noradrenaline. When I say there is inhibitory actions is more, that suggests that there is more or abnormal release of GABA and serotonin like neurotransmitters. Of course, in the dopamine, again we will have dopamine 1 and 2, so that much of detail we will not go now, that we'll see later. This is the basic information. Okay, now what actually happens is, suppose the inhibitory neurotransmitter, that is GABA, gamma aminobutyric acid, even most of the excitatory neurotransmitters are also formed from the inhibitory neurotransmitter itself. That means GABA itself will go into change into glutamate, and GABA itself will go into change into dopamine, or GABA itself going to change into adrenaline, etc. So that we'll see later. Okay, now when GABA, which is the most predominantly a inhibitory neurotransmitter, when it is weak, what happens? Naturally, it is a known fact that excitatory neurotransmitters will take the upper hand, because there is no inhibitory neurotransmitter present. So inhibitory neurons are less active, and as a result, the excitatory function will be more dominant. So when GABA is weak, there will be undue spread of the current, and then a large area of the CNS will fire at a time. Okay, so when GABA is weak, excitatory will take the upper hand. When excitatory is more, excitatory is less, GABA will take the upper hand. Okay, GABA will take the upper hand. Now we come to some of the basic information of a GABA, because understanding GABA is very important. GABA means gamma aminobutyric acid, one of the inhibitory neurotransmitter. Now, so there will be, when the GABA is weak, suppose what happens if the GABA is weak, and there will be undue spread of the current, when abnormal electrical stimulation is happening or spreading, then if the GABA is weak, then a large area of the CNS will go into fire at a time. Okay, so there will be repeated train of action potential synchronizingly. So if undue spread involves a reticular area, now understanding this part is very important. Now, abnormal electrical discharge may start from one particular area, localized area within the brain, okay, from the cerebral cortex, or it may be involving the multiple areas. Okay, so then depending upon the force and intensity of that abnormal electrical discharge, it will go into spread. Sometime abnormal electrical discharge start, it travels only for few centimeter area, stop there. Then what happens? The presentation in the patient will be very less, because it is not involving the more areas or more centers. Okay, sometime from the right side the abnormal electrical discharge start, and it spread to the left hemisphere also. Then it is obvious that comparatively the presentations will be more. Okay, sometime what happens, the abnormal electrical discharge start from one area, spread to the other areas, and also spread to the reticular activating area. Now this is very important. What is reticular activating area? Reticular activating area is actually a bridge between cerebral hemisphere and basal ganglia and hypothalamus. Hypothalamus is the relay station for all the sensations, we know that. The sensations which are coming through the ascending tract from the periphery of the body also passes through the hypothalamus and basal ganglia, and motor responses which are coming from the upper part of the body, that means from the center to the periphery, also pass through this area. Therefore, reticular activating area is a connection between the rest of the brain and as well as a cerebral cortex. That's the only connection. It's a dense packed area. Now, abnormal electrical discharge spread to the from the cerebral cortex, if it starts spreading to the reticular activating area, now reticular activating area is also start doing function abnormally. What is the function of the reticular activating area? It takes all the sensation, touch sensation, pain sensation, crude pain, then crude touch, vibration, proprioceptive receptors, many sensations to the brain through reticular activating area. Okay, so when there is no sensation received, suppose reticular activating area is now abnormal and it is not in a position to receive any sensory signals from the hypothalamus and basal ganglia to the cerebral cortex. Now what happens? Cerebral cortex will not respond to any stimulus because it is not reaching the cerebral cortex sensory cortex at all. Cerebral hemisphere central cortex at all. It is not at all reaching. When sensation is not reaching the sensory cortex of the cerebrum, how can it give you a motor reflex or motor response? It is not possible, isn't it? So when there is involvement of the reticular system, activating system, what happens? All the sensations which is carried from the basal thalamus and basal ganglia to the cerebrum is blocked. Cerebrum is no more receiving any signals now, and there is also no motor response. Okay, now patient falls unconsciousness. Patient fall unconsciously. This is the reason why in case of epilepsy or seizure disorders have unconsciousness. When you will have the unconscious? When reticular activating area is get involved. Abnormal electrical discharge also now enters into the reticular activating area. It is also called as corona radiata. Okay, area. Then you will have unconsciousness. So if you are a patient with a loss of consciousness, it suggests that abnormal electrical discharge now reach the spread up to the reticular activating area. See, this is actually happening during the time of the sleep in a normal person also. During the time of the sleep, we are almost all in a state of unconsciousness, isn't it? Okay, we don't know what is happening anywhere. Why? Because during the time of the sleep, our reticular activating system is taking rest. Because of the depletion of the neurotransmitters, because of the continuous work in the daytime, we get tired. We get tired means the neurotransmitters are less and reticular activating system is not carrying any sensory stimulus to the cerebrum. And as a result, person will go into sleep. It is also a type of unconsciousness only. Same thing also happen here abnormally. In case of a seizure, same thing occurs abnormally because of abnormal electrical discharge spreading in the reticular activating area. The sensations are not able to reach the cerebrum, and as a result there is no response and patient falls unconsciousness. Okay. Now, in some people, this abnormal electrical discharge spread to a limited area and limited to one hemisphere. Okay, sometime abnormal discharge will start is limited to one particular area of the hemisphere, and limited to that hemispheres only. Then such epilepsies are called as partial epilepsies because the symptoms which are presented are very partial. There is no unconscious. Usually there is no unconsciousness. Unconsciousness happens only if it reaches the reticular activating area. Okay, now. So onset of the seizures are referable to one hemisphere, and if there is no unconsciousness, then it is simple partial epilepsy. Now, partial epilepsy is of two types, simple and complex. In partial epilepsy, from the one cerebral hemisphere, the abnormal electrical discharge starts at a one point, it spreads. Okay, if it spreads. And if it is spreading and spreading, if it is not reaching the reticular activating area, by the time it diminishes, then there is no unconsciousness. Only some of the symptoms related to the cerebral hemisphere, one part will come. Then we will call it a simple partial epilepsy. If that electrical discharge started from a hemisphere point, reaches the reticular activating system, then there will be unconsciousness for some time, or maybe for a short time, unconscious along with the other symptoms. Then we will call it a simple partial epilepsy. Simple partial epilepsy. And if there is altered unconsciousness along with the limited area of involvement, then it is called as complex partial epilepsy. We have already seen that. That means if there is unconsciousness, means the abnormal electrical discharge is somewhat reaching to the reticular activating area. This is quite sure. Okay. Now, and Now we come to the next part. In epilepsy, there will be abnormal electrical discharge which gradually spread throughout the cortex and even to the other parts of the cortex, opposite cortex, left cortex or right cortex, leading to certain motor and sensory and autonomic changes. This is exactly happening in case of epilepsy. Okay, we have so far seen it's partial epilepsy. Okay, in a full-fledged epilepsies, which we call as generalized epilepsy, then an abnormal electrical discharge starts from one hemisphere, right side hemisphere, suppose. Then it gradually spread to the opposite side, to the left hemisphere. Then it also reaches the reticular activating system. Okay, so in epilepsy, there will be abnormal electrical discharge which gradually spread throughout the cortex and also other part of the cortex, leading to certain motor and sensory and autonomic changes. Once the abnormal electrical discharge ends, the episode will also end. It also, just like the electrical current going on. When the current is gone, nothing is there. When the current comes, everything starts. If the current is more, sometime in rainy season and all, we will have overflow of the current because of problems in the earthing and all. So once the overcurrent comes, it destroys everything, isn't it? Destroys the TV, destroys the mixie, destroys anything running electronic items. Similarly, here also episodes comes. Once that abnormal episodes come, then it will destroy everything for a time being. Then the things become back to normal. So once the abnormal electrical discharge ends, the episode will also going to end. Abnormal electrical discharge occurring is always due to the pathology related to more excitatory neurotransmitter release or less inhibitory neurotransmitter release. This much is clear. Okay, so now if it is spreading everywhere, including what you say, the reticular activating system, then you will have a complete form of epilepsy or generalized epilepsy with the automatism or unconsciousness, etc. Okay, now why this abnormal electrical activity starts? I told the neurotransmitter and all those things. When the excitation is more, now abnormal electrical activity can start because of two things. One is excitatory neurotransmitters are overfiring. Inhibitory is normal, but compared to that, abnormal excitatory neurons are very much over functioning. Or excitatory neurotransmitters are normal, but inhibitory is very much low. Both these conditions leads to abnormal electrical discharge. Most of the time, it is triggered by certain triggering factors. Now, why suddenly a excited neuron start giving over response? Usually, most of the time, it is by means of triggering factors. Okay, when you are doing some more exercise, or if there is sleep deprivation, if there is fasting, if there is electrolyte imbalance, if there is stress, then these excited neurotransmitters start giving more response, over response, leading to this type of abnormal electrical discharge. Okay, so now we come to, this is the basic. Okay, GABA, glutamate, everything we have discussed. Two things are very important: excited neurotransmitters and inhibited neurotransmitters. Okay, and if their overfunction or underfunction itself is the cause for abnormal electrical discharge. Now, when a given condition is, suppose if you call a given condition in Ayurveda as Apasmara, most of the time we compare Apasmara with epilepsy. Okay, in Ayurveda standard, if you consider any condition as epilepsy or Apasmara, it has to fulfill the following factors. What is that? When we call a paroxysm as epilepsy, so to call any event, paroxysm means sudden spontaneous event. Okay, so when you call it as epilepsy, if Apasmara, which is explained in our science, if it fulfills this particular criteria, then we can compare Apasmara with the epilepsy. What are those criteria? To say any attack as or any paroxysms as epilepsy, the following factors should be there. What is that? Number one, there should be a seizure attack with the involvement of motor, sensory and autonomic involvement, isn't it? Now you look at and go and see, look at Apasmara, and do you find such symptoms? Then the seizure should occur in the current manner or episodic manner. The seizure should occur in a one single episode, or it should occur in episodic. Repeated attacks should be there. Repeated attacks should be there. Number one, there should be any absolute identifiable cause. I think it should be, there should not be. Okay, there should not be any absolute identifiable cause for this particular attack. Next, there should be automatism. Automatism means this lip movement, snacking movement, loss of consciousness for seconds or for minutes or for hours together sometime, or sometime just blackout, tamapravesha, just blackout, as occurs in case of Jackson and fits and all, just blackout. But this type of presentation should be there, which is called as automatism. Okay, that means the abnormal electrical discharge touching the reticular activating system. It may be for a few minutes, for seconds, or whatever. In Jackson and fits, it's for just seconds. So there should be three phases like aura, ictal, and post-ictal phase. Okay, so if these manifestations are there, steps are there, then we can call that particular condition as epilepsy. Okay, of course, this aura, ictal phase, post-ictal phase cannot be seen in all the conditions of epilepsy. In case of idiopathic epilepsy or generalized epilepsy, it is seen. In other epilepsy syndrome and all, it is not seen. Anyway, but if our Apasmara fulfills all these criteria, then we can call Apasmara as, or we can call epilepsy as Apasmara in Ayurveda. Now, there are three important manifestations in Apasmara, like derangement of the smriti or samya, then there is derangement of the buddhi, and there is also derangement of the mind. Okay, the dhriti smriti vibramsha. Okay, so smriti is affected, buddhi is affected, mind is affected. Now if you take a smriti, samya, buddhi, all these are the sensory and motor activities, and there will be transient loss of consciousness also, because it touches the reticular activating area. Transient loss of consciousness also. This is mentioned as tamapravesha in Ayurveda. So that is sensory, motor, and autonomic functions are affected. This is mentioned by smriti vibramsha, buddhi vibramsha, and the mano vibramsha. Then also there is tamapravesha, which is indicated in the automatism. And there will be some bibhasa chesta also. There is some bibhasa chesta also. Abnormal, horrible, scary body movements and expressions will be there given by the patients, which suggests some abnormal muscular contraction also. Bibhasa chesta. Okay, because when muscular contractions are abnormal, the facial expression will be a little bit abnormal. Or this may be also compared with the abnormal motor movements leading to bibhasa chesta, or some of the psychomotor activities also. So, in short, to say, the criteria which is given to say that this is a case of epilepsy has been explained in the context of Apasmara also by Ayurveda long back. So same is explained in Charak Samhita, Nidanastha, that Apasmara occurs in such individual whose mind is afflicted with Raja and Tama, Upahata Chetasaha, who have scattered abnormal and excessive doshas. Again he says that, who practices the tantric procedure abnormally, who use unhygienic food habits, lifestyle, because we know that sattva has to be maintained. Sattva can be imparted only by the sattvika food, and those who are taking the tamasika and rajasika food may develop this type of deficiency in sattva. That means balance between this excitatory and inhibitory will be lost, and that may lead to epilepsy. Uneven body posturing or different other causes of kshaya may also lead to the epilepsy. This is what is explained in our science. Of course, we will going to see this in detail from the next classes. In the next class, we will see whether Apasmara is equal to epilepsy or not. If so, how we can compare this with the epilepsy, and what are the different motor symptoms which are explained in Ayurveda, what are the sensory symptoms, what are the psychomotor symptoms explained in Ayurveda. In detail, we will going to see in the next class. Thank you very much for your patience listening. And also don't forget to subscribe my channel, and also please give your valuable comments. Thank you very much.